Welcome to the COVID-19 and prevention. Hi, I'm Dr. Catherine Y. Brown. Thank you for agreeing to participate in this study about COVID-19. The study is being conducted by the Tennessee Community Engaged Alliance Against COVID-19, also known as TNCEAL. It is led by Dr. Paul Juarez, professor and researcher in the Department of Family and Community Medicine at Meharry Medical College. This study will help us better understand the level of knowledge, attitudes, and behaviors and the effects that COVID 19 has had on your life. This study consists of watching two videos about COVID 19. The two videos are about 10 to 15 minutes in length each. At the end of each video, you will be asked to answer a brief survey. Directions will be provided at the end of each video. The first video is going to focus on what is COVID-19 and how can you prevent getting it. Today, we have with us an expert on COVID-19, Dr. Jim Bailey. Dr. Bailey is an internal medicine physician. Dr. Bailey is the Robert S. Peard Endowed Chair in Internal Medicine, Professor of Medicine and Preventive Medicine at the University of Tennessee Health Science Center in Memphis, Tennessee. He practices as a primary care physician in general internal medicine for adults with complex chronic illness. Welcome, Dr. Bailey. I'd like to start by asking you to describe your background and interest in COVID 19.
Sure. It's a pleasure to be here with you today, Dr. Brown. And it's really important to me, and I'm very proud to be part of this effort in Tennessee to help our communities, especially our communities of color, protect themselves and their families against this terrible virus. So I've been practicing internal medicine, which is really just primary care for adults, for 30 years here at the University of Tennessee Health Science Center in Memphis, Tennessee. And I practice at Regional One Health, the Regional One Health Outpatient Center. People know Regional One is the med from days of old, but really I came here to Memphis, originally from Alabama, and then from Seattle, Washington, where I studied internal medicine, primary care, and public health. I came back to the South because I wanted to be part of making the South healthier. And I really dedicated and have dedicated my life to both, well, really all of our underserved communities in the South that struggle more than anywhere in the country with illnesses related to overweight, obesity, and all those illnesses, heart disease, high blood pressure, that put our people at increased risk of COVID-19.
Thank you, Dr. Bailey. Now let's talk about COVID 19. What exactly is COVID 19?
Sure. Germs are mysterious, right? Because they're so small, we can't see them. But COVID-19 is among those smallest of all germs, viruses. It's a virus. And some people call it goes by, COVID-19 goes by many names. Coronavirus, SARS-CoV-2 is a name you might have heard. And then sometimes they'll call it the novel, the new coronavirus. But coronaviruses have been around a long time. Our children and we as a child, adults as well, get coronaviruses throughout their life. We probably get 5 or 10 different coronaviruses during our lifetime, many people more. But this coronavirus is a particularly bad one. And it makes people much sicker than most coronaviruses do.
How can I stop the spread of COVID-19?
Yes, that's what we all want to do, right? Because we want to protect our families, our loved ones from this very bad virus, which is, it's like a worse version of the flu than you've ever seen. Um, but there are several ways we can protect ourselves and our families. Number one, these days is the vaccine, and we're going to be talking a lot about getting vaccinated and why that's a great thing to do for yourself and your family. I believe it is. But in addition, you can protect yourself by wearing a mask and staying out of crowded places. We're learning that this virus is especially transmitted in the air, and especially where there's not good ventilation. So like I went to see my son for Father's Day yesterday, and a friend was there who wasn't vaccinated. So we ate outside and we stayed far apart and we wore masks, even though I've been vaccinated, because that helps protect anyone around me. But he hadn't been vaccinated and we wanted to be especially safe. So we stayed outside where the air circulation is better. So masks, staying outside if you're in a group, staying far apart, 6 feet or more, getting vaccinated, those are all things you can do to protect yourself and your family.
How does the virus impact the body, and why are symptoms different for different people?
Oh, that's a great question, Dr. Brown. You know, every virus is like this, is different people react in different ways. And that probably has to do with their exposures to different coronaviruses through their life, their age, and other factors that affect their immune systems. And every one of our immune systems is a little different. But so the main symptoms that we see are fever and chills. Those are number one, followed by cough and shortness of breath. Those are the most common symptoms. But some people even go through it with no real symptoms at all. They get a mild case. Maybe they've got some antibodies related to infections they've had in the past. Some people may not have symptoms at all. And then the other symptoms that some people will have are loss of sense of smell or sense of taste that can last for a while sometimes. Runny nose, sore throat, fatigue, just feeling really tired, exhausted. That's what my mother-in-law who got it, that's what she experienced. She just had to go to bed. She felt so tired. But those symptoms can be different in different people. But I'd say the most common ones are feverish, feeling feverish, chills, and cough. And then after that, shortness of breath.
How is this different from the flu?
Yeah, the flu is a particular virus. It's a particular virus that is similar to the coronavirus, but it's a different one. If you could look at it, look at each one with a super microscope, you'd see the differences. The coronavirus, they call it that because it looks like a crown. It has all these little spikes that stick up that are called spike proteins. And influenza has a different look to it. It's more of a ball, I would say, without all those spikes. But it's a very similar virus in that each of these viruses is a respiratory virus. Each of them are transmitted mostly in the air. And each of them can really give you a lot of fever and chills. And the only way to know for sure which virus you have, if you get that kind of a viral syndrome where you get fever and chills and feel really sick, maybe with a cough, is to get a test, is to get a blood test to see which one it is. Or actually with coronavirus, it's a swab usually. a swab test of the back of your nose where this virus collects and invades the cells of our body.
Who is most at risk for contracting the virus?
Yes, all people are at risk. Really, all people are at risk, but I'd say frontline workers. If you're around a lot of people or in close quarters with a lot of people, you're at the highest risk for getting the virus. But to me, the more important question is who is at highest risk for getting really ill from it, from dying or having to go to the hospital. And I hate to say this, but our communities of color are among those people at highest risk. And why is that? The main reason that communities of color are at highest risk for getting severe illness is because communities of color have higher rates of overweight and obesity and heart disease, high blood pressure, all those things that can go with overweight and obesity. And those are the real dangers: overweight and obesity and heart disease, diabetes, all those conditions that people of color, communities of color, are at increased risk for. Those are the conditions that put us at higher risk of severe illness, of getting illness so bad that you have to go to the hospital, or that you might have to go to the ICU, go on a ventilator, or even die from this virus. And one of my friends, a researcher, an African-American researcher, really prominent in Louisiana, did a study in the hospitals, and she found that when we took account of overweight, obesity, and diabetes, that all the differences between whites and blacks went away, that whites and blacks had the same risk once you account for obesity, diabetes, and heart disease. So it's really obesity, diabetes, and heart disease that put us at risk. And that's why our grandmothers, grandfathers, mothers, and fathers with overweight, obesity, heart disease, high blood pressure, diabetes are particularly at high risk from this dangerous virus.
Can you describe the devastation in our communities?
Oh my goodness. The devastation is on families who lose loved ones, unnecessarily from this terrible virus. And the first death in Memphis from coronavirus was a friend of mine. He ran facilities at the University of Tennessee for years. And 2 weeks after he retired, he got coronavirus and had to go to the hospital, got short of breath. He was looking forward to enjoying his retirement with his family. He'd worked all his life for that. And here, 2 weeks after he retires, he gets the virus, ends up getting short of breath, having to go to the hospital, quickly has to go to the intensive care unit, is on a ventilator, and within 2 more weeks, he was gone. And to me, that's the biggest devastation. But beyond that, people in our community have lost their jobs because of this virus, or have just experienced, because of the dangers of COVID-19, they've done the right thing. They've isolated themselves. We've been seeing lots of loneliness, depression, anxiety, and that has, for many people has been really severe because of having to isolate oneself from others and not be around grandkids or family members because you're trying to do the right thing and protect them and yourself. So I think It's been about jobs. It's been about social isolation. And then it's been about severe illness and death. You know, those things have been really devastating, in particular for communities of color. But for all people in Tennessee, one of my white neighbors in my neighborhood, just a few blocks from here, she lost her husband. And he was a little overweight, but really didn't have a lot of risk factors. And that's the strange thing about it, is one person with diabetes will not even get that sick. On average, people with diabetes are going to get a lot sicker, but some will not even get real sick. And then here's this white man who's only a little overweight, maybe has a little high blood pressure. He gets it, and within a few weeks is dead. And my neighbor, my other neighbor is devastated. So to me, these losses of these wonderful people to our community are the biggest devastation of this illness.
How does this virus specifically impact communities of color?
Well, it's the infection rates are higher, right? And communities of color, because in the Memphis area, those communities are lower income, whether they're Latino or Black groups, those groups are lower income, and that means that they live in more crowded housing. They're more likely to work as frontline workers with, in stores and restaurants, and more likely to be exposed. So not only are communities of color in more crowded situations, they have to go to work, because they're lower income. They can't just sit back and rely on their bank account. They got to get to work. And so they're more likely to be exposed. Because they're more likely to be overweight, they're more likely to get severe illness. So it's like a double whammy on our communities of color. And that's why African-American people and Latino people or Latinx people are much more likely to get infected than other people. They're much more likely to get severe illness, and they're much more likely to die. So we have to do more to protect our communities of color.
What are some community resources that will help people impacted by COVID-19?
Sure. I think the most important community resources right now are resources for getting vaccinated. And we'll talk more about why I believe the vaccine is safe and effective. But I will tell you that I and all of my family members, my mom, my sister, her children, my children, all of us have gotten vaccinated. And so some of the most important community resources are our pharmacies, ranging from the one here at Regional 1 to Walgreens, to CVS, to Walmart pharmacies, where you can get free vaccines. And I think they're right up at the top of the list. But our community health centers, in Memphis, we've got Christ Community Health Services, we've got Cherokee Health Systems right here, we've got Regional 1 Health, we've got Church Health, we've got clinics where you can go. I know some of these clinics, it's not easy to call. You can call too and ask to speak to a doctor, ask to speak to a nurse, get information about COVID-19 and how we can protect ourselves and our families. There are also at these community health centers, social workers that can connect you to resources around helping you get housing, if you have housing needs, helping you get food for your family, if that's a need. And the Memphis Food Bank has food distribution centers at many of our community health centers in town. So there are a number of resources to help us with issues around transportation, housing, getting healthy food, and getting the healthcare we need. It's still not easy. We all know that. It's not easy to get to the doctor's office. It's not easy to get through on the phone. So I think the other thing people can do is educate themselves as much as they can, and they can Google on their phones the SEAL, CEAL, for the Community Engaged Alliance Against COVID-19 Disparities. The SEAL website, there's a lot of good information there. I trust the CDC. They don't always get it right the first time, but they eventually get it right. I go to the CDC website for information, and I think it's still about the best information out there. But we've got a lot of good information on our SEAL website, tn-ceal.org, about how to protect yourself and your family against COVID-19.
What are some common myths?
I've heard this business about the microchip. I've heard people concerned about that this vaccine has a microchip in it and that Bill Gates or somebody else is going to use it to track us. I know that's not true because they still haven't figured out how to make a microchip small enough to go through a needle. One of these tiny, tiny needles that they use for the vaccine, because it really is a small needle, despite what people tell you. So I know the microchip thing isn't true. I've also heard rumors and myths that COVID-19 vaccine is killing people, that it's not COVID-19, it's this vaccine that's killing people. And what malarkey, but I know that's not true because I've looked at the data. I've seen the people. I've talked to the families that have gone through COVID-19 and experienced deaths from it. Now, it is true because we've been especially vaccinating people who are older, who struggle with diabetes, with obesity, that sometimes people get the vaccine and because of their heart disease or they have a stroke or something else, there have been deaths after the vaccine. I mean, if you're 90 years old and you've got heart disease and cancer and 3 other things that make you frail, there are going to be a few people that after getting the vaccine are going to pass. But I have not seen one person or seen a report of one person across the whole country that has died because of the COVID-19 vaccine. So I know that that's not true from what I've seen firsthand with my own eyes. The good news with the vaccine is it's like getting 100 times milder version of COVID-19. It is so mild. I've also heard the rumor that it has the live virus in it, and it doesn't. It just has, and it's really neat how it works. We're going to talk more about this later. It just has a message, like a message in a bottle, on how our body, it teaches our body to make the antibodies against the virus. But it doesn't have any virus in it. So it can't make you sick like the virus does.
So when should I get tested for COVID-19?
That's a great question. My son for a while, because he was a frontline worker and still is a frontline worker. He was getting tested every week just to see, Now, I think that may be a little much to get tested every week, But for a while, he and his girlfriend were doing that just to be extra careful. But what I would recommend is that if you feel feverish, you get a cough, sore throat, fever, chills, any of those symptoms of COVID-19, that you go right away and get tested and then quarantine yourself, until you know your test is negative. Now, they do have a rapid test where they can let you know right away. But even with the most accurate test, it usually is no more than 2 days before you know your result. So the main thing you should know is if you get symptoms that you think could be the virus, get tested. And you can go to any of the pharmacies, any of the major pharmacies, and get tested. And there are a number of other places you can get tested in our community, like Cherokee Health Systems. They have a testing site, like Christ Community Health Services. They have a testing site. If you're a patient here at Regional One, or you want to become a patient here, you can come here and get tested or get your vaccine.
Thank you. Now, when should I quarantine and what exactly does this mean?
Quarantine is not easy. It means staying away from everybody. That's what it means. And you should quarantine immediately whenever you think you have the virus or have been exposed to the virus. If a friend calls you that you were around, you were hanging out with, and say, I just found out I'm positive for COVID-19, that means you should call work and say, I've been exposed to COVID-19 and I've been told to quarantine. And at that point, quarantine means being in your own room, not going out of that room or around other people. It means even quarantining from your other family members. And you can get advice on how to do it by calling your doctor's office, by calling the health department, by calling us here at Regional One. But, it means hanging out in your bedroom, letting somebody bring food to your door, having other people in your house wear a mask, if you stay in your room, you can protect your other family members from getting COVID-19. It's amazing, but just staying in your room and not going out and having people wear a mask when they come to your door, and open and close that door, just doing that does a really good job of protecting you. It's not 100% protection if you're in the same house, but it's about 80–90% protection, which is mighty good. So quarantining works to protect you and your family members from the virus.
Now, what are the different types of COVID-19 tests available?
Well, there are two main types. There's a rapid test and there's the regular DNA test, or they call it a PCR test. All these acronyms. But I just think of the regular test and the rapid test. Both are a swab, and they put the swab back in the back of your nose until they touch almost the very back of your nose, which connects to the back of your throat. It's the area we call the pharynx. So it feels fun. I think it tickles. I've had about 4 or 5 of those tests, and it's real ticklish. It even might make you sneeze. And for some people, it's a little uncomfortable. But for me, it never hurt to have that test. But they put that swab back into the very back of your nose and twirl it, kind of rub it against the back of your nose or back of your upper throat there. It doesn't make you feel like you have to gag at all because it's not down in your throat. it's more the back of your nose that they're getting that swab from. But either way, they take that swab and get an immediate result back with the rapid test, and or within a day or a few hours, usually within 2 hours on the rapid test, or 2 days with the regular DNA test. Both of the tests are really accurate. If they say that you've got COVID-19, it's nearly 100% true. No test is perfect, but if it shows you're positive for COVID-19 with the rapid test or the other test, it's almost certain that it's true. There are a few false tests, but most of the time it's true. With the regular test that takes 2 days, its accuracy is over 95%, and the other test is over 90% accurate. So both are really accurate at diagnosing COVID-19, and can reassure you that I had an exposure, but I'm not positive here at 3-5 days out. And if you're not positive after a week of being exposed to somebody, it's safe to go out of quarantine.
So I know you just shared this, but I want to make sure that I recap. How effective are the tests for determining if someone is positive for COVID-19?
Yes, I would say very effective.
Thank you. And then how long does it take for the COVID test results to come back? You shared it, but I want to make sure that we highlight.
So in general, within 2 hours for the rapid test, and within 2 days for the regular test or the PCR test.
Now, why is my COVID-19 test positive and my husband's is negative, and we live in the same house?
Yeah, isn't that something? We talked about this some. Even if you're sleeping in the same bed, even if you've kissed one another, it's still possible that one of you could get it and the other not, that it not be transmitted. It's most likely, but it could be that when you were most infectious, that maybe you were asymptomatic, maybe you weren't coughing, maybe you weren't around your husband quite as much. Maybe you just got lucky, because the more virus you're exposed to, the more chance you'll get it. So the highest odds of getting it are if you, or of your husband getting it, if you had it, would be if you had a bad case and you coughed right in his face, right? And you were really sick. Then he'd almost certainly get it. But if you're asymptomatic and maybe you weren't around him a whole lot, right when he was most infectious, you might not get it. Or even if he had a bad case and he stayed in a separate bedroom, you might not get it. Particularly if he stayed in a separate bedroom and you wore a mask whenever you opened the door. You can protect yourself from this virus. And do a good job of that, even when a family member has it.
Thank you, Dr. Bailey, because that was a very frequently asked question. Now, can I get a free test, and how much are the tests?
So the tests are free almost everywhere. And so, yes, you can get a free test, and you can get a free test at any of the free testing sites, which is pretty much everywhere that does testing. So at community health centers like Cherokee Health System, Christ Community Health Services here at Regional 1, at pharmacies like Walmart, CVS, Walgreens, Kroger pharmacies, at all those locations, you can get free tests. So the best thing to do is call the place you want to go that's closest to you and say, do you have free testing? Or look on the internet. But all of those providers, pharmacies and clinics have free testing available.
What does a negative test mean, and how much should I trust it?
Yes. You know, we talked about if you have a positive test, it's almost certain that you've been exposed, that you've got virus in your body. If you have a negative test, once again, it's almost certain that you don't have the virus, that you don't have that virus in your body. However, if you've recently been exposed, it's still possible that you're infected and that you got a false negative test. So if you've been asked to quarantine, or a friend or a family member has COVID-19 and you've been exposed to them, even if you get a negative test, you should not go out of quarantine until you've been without symptoms and had negative tests for 7 days. So a good thing to do is to get a test if you've been exposed in the middle or near the end of that time. If you have a negative test and you don't develop symptoms after 7 days, then you can be really confident that you don't have COVID-19. You don't have the virus in your body. You know, one of the tricky things is children in particular can have it and be asymptomatic and pass it on to somebody else. It doesn't happen as often as it does with somebody who has symptoms, but it still can happen. So if you're concerned, get a test. And if you're not sure whether you should go back to work or not, talk to your doctor or somebody with the health department or a nurse practitioner, or one of our community health workers at our community health centers, like Cherokee Health Systems or CCHS, Christ Community Health Services, or here at Regional One. We'll help you know what you need to do.
Excellent. Thank you, Dr. Bailey. And thank you to our viewers. Remember to complete the brief survey. Also, remember to watch the second video that will address the COVID-19 vaccine. In that video, Dr. Bailey will talk about COVID testing and the vaccine. Until next time, I'm Dr. Catherine Y. Brown, and for more information, visit the website tnseal.org. Have a great day.